As quickly as COVID has adapted, or we discover something new about how the virus spreads and interacts with the human body, technology has had to adapt with it. We are in a new phase of handling COVID, with the recognition of post-acute sequelae of COVID-19 syndrome. There are multiple theories about the causation, possibly an immune response, damage to neurological pathways, tissue damage to vital organs such as the lungs and kidneys. Most probably, it's going to be a combination of multiple theories. But that is where we're at, hypothesizing, theorizing. And this is where m.Care takes previously created technological pieces that have been used for mobile patient engagement and monitoring and applies it to real-world problems. We can help put together what at first seems like an overwhelming potential data points and create care or monitoring plans for patients. These monitoring plans can help illuminate possible causative or targeted effects of post-acute sequelae of COVID-19. Our most recent update includes 22 unique Apple Research Kit tests, which allows our app to facilitate tests on auditory, visual, cardiovascular, cognitive, and mobility functions of patients. We have also recently integrated live streaming face analysis that can be turned on during the previously mentioned medical test. The live stream continuously monitors 76 landmarks on the face, which can be used to analyze multiple neurological conditions and drive functions upon the screen for those who have difficulty with mobility and need to use eye movement, face gestures, or head tilt movements to facilitate language or taps upon the screen. Here we're going to focus on 3 tests that can be used to help assess brain fog and cognitive ability of patients with post-acute sequelae of COVID-19. The first is spatial span memory, which tests a user's ability to repeat sequences of randomly highlighted flowers with increasing degree of difficulty after each round. The second test is trail making, which evaluates your visual attention and task switching by recording the time required to tap a series of dots in order. In this test, the required order is 1 to A, then 2 to B, then 3 to C, so on and so forth until you reach the number 7. These medical tests can be coupled to a long list of other medical applets, like having a patient fill out a survey either before or after the test. How did you sleep? What was your level of pain today? Did you have difficulty breathing? Or maybe you'd like the patient to also sync up via Bluetooth or manual entry their most recent spirometry, pulse ox, or blood pressure values. And of course, scheduling and getting those visits with the patient via video conference calls so a medical team member can assess the patient over a live video feed. We all have different health paths and journeys that are the sum of our life experiences. This includes genetics, stresses, trauma, sleeping habits, social connections, desires, wants, expectations, and regrets. The whole picture of the patient defines their health, not just a diagnosis or a disease. m.Care is that centralized digital healthcare platform that can capture the whole picture of a patient and merge those pieces of a patient's health with the stringent requirements of standardized medicine.